Hello athletes, welcome to another video on A-Level P. This one's on injuries in sport. It is designed for A-Level P, but if it helps you for any other course, BTEC, for even maybe GCSE, some GCSE specs, whatever it might be, or you're just interested in injuries, then great. Let's have a little look at what we are going to learn. And there'll be 4 parts to this video. First part, we're going to look at identifying acute and chronic injuries. You need to be able to tell the difference between the two. You'll need to be able to describe and explain certain injuries along with the symptoms that they come with. That's the sort of what do you need to know. What sort of questions might you get if you have an exam question on this? They're in blue, they're in red there, some of the previous questions that have come up. Quite simple, tend to be more knowledge questions than analysis, although they can be part of a longer question. Sometimes quite simple questions. Apart from dislocation, give us an example of an acute injury and a chronic injury. This is a nice simple question that once you've watched this video, hopefully that will be quite simple for you to do. Ankle injuries are common in elite runners. Identify common ankle injuries. Yeah, and that was one that was part of a longer question. That was part of a 20 marker. But you probably can already identify ankle injuries already without doing this, watching this video, but you'll know about sprained ankle probably is the first thing that comes into your mind, so you'll be picking up marks by even watching this already. Compare acute and chronic injuries, so impact injuries and injuries that occur over time. Fairly simple one. What could you do while watching this PowerPoint? You could summarize some of the slides or all of the slides, make notes, you could make a table, however you like to learn, do that. And how can you challenge yourself? How can you push yourself to the next level? Aim to recall common injuries and also know the signs and symptoms of each. That's a simple one, that's not really challenging, but be able to give an example of when the injuries occurred in an elite sports situation. That might be a challenge. You could look that up. When has someone dislocated a joint in a match or a game, whatever sport it is you play, and be able to compare and explain differences between similar injuries. So how do you differentiate between a sprain and a strain? That's a question you'll get asked quite commonly. And then maybe think about scenarios. What would be the worst possible injury for a tennis player, for example? What would be the worst possible injury for a quick winger in rugby? So really starting to think about injuries. So let's have a look at acute injuries. So these occur suddenly after a stress or impact to the body, such as a fractured fibula after a bad tackle in football. So there's a quick impact, or there's some sort of impact which causes an injury, as opposed to a chronic injury which happens over time. A chronic injury like a stress fracture, for example, is a result of overtraining or doing too much training, whereas an acute injury, 1 second you're fine, the next second impact when you're injured. Okay, so this will be things like a fracture. Good example of a fracture. You guys are probably, mostly watching this video will be too young to remember, but Paul Gascoigne was a fantastic footballer. He broke his leg in the 1991 FA Cup final. That's a acute injury and a fracture. He broke his tibia or his fibula. That would be an example. You can probably think of a number of footballers that have broken their legs. Aaron Ramsey springs to mind a few years ago when he was playing for Arsenal. I'm sure there's plenty of others as well. So a fracture is a partial or complete break in a bone. Skin remains unbroken in a closed fracture. Being an open fracture, the bone actually comes outside of the skin. It's quite nasty. Signs include swelling, deformity in the injured area, and discoloration, bruising. Symptoms include pain, obviously, and inability or limited movement in that area. And just want to go back to, again, types of injury. So hard tissue and soft tissue. Hard tissue injury simply means an injury to the bone, such as a fracture, a joint, or the cartilage. A soft tissue injury is a skin, muscle, tendon, and ligament. Next one, dislocation. Now, dislocation occurs from a direct force, such as an object or collision, or an indirect force, such as a fall. The joint is forced past its extreme range of motion and dislocates. Obviously, there's a limit to how far a bone can move within a joint. If it moves beyond that, it might dislocate. You've got certain things, certain structures holding it together. but again, they're sometimes not strong enough, particularly when large forces are put through that joint. Signs include deformity, swelling and discoloration. Symptoms include pain, loss of movement, sometimes actually feeling that pop or hearing that pop within the joint. And you probably remember Mo Salah getting injured in the Champions League final 2018 in the collision with Sergio Ramos. Landed awkwardly on his arm, but affected his shoulder joint, and he was tangled up with Ramos, and took that joint beyond its normal range of movement, which resulted in a dislocation. So, two more acute injuries: contusion and hematoma. Contusion, you probably know, is a bruise. The blood vessels have become damaged in that area of skin. Usually a minor injury, you get them quite a lot. However, deep tissue damage can result in a hematoma. This is internal bleeding under the skin of deep tissue. This is a little bit more serious. Severe bruising. Signs include swelling and discoloration, as you can see in the pictures, and they go from one extreme to the top extreme. This is a soft tissue injury. Symptoms include pain and painful to touch that particular area. Sprain. A sprain is caused by a sudden or unexpected twist or extreme rotation in a joint, usually during a landing or fall. They're common at the ankle for games players. Most people that play sport have or will experience some sort of sprain, often in the ankle when you land funny. Sometimes sprains can be fairly, some can be more severe than others. So there's different gradings of sprain. We don't need to know about that for A level. You just need to know that a sprain is damage to that joint and the ligaments within that joint. Signs include swelling and bruising and difficulty. Symptoms include difficulty weight bearing and pain. You probably know Harry Kane. He's had several ankle injuries, sprained his ankle before, but recovers. Often it's when you land, might be basketball, could be football, could be rugby, anywhere where you land awkwardly and your ankle, you rotate on your ankle, putting it beyond that range of movement, really pulling at those ligaments and causing that sprain in the ankle. A strain. So this is when you often get asked what's the difference between a sprain and a strain. So a strain is muscular, is an injury to the muscle. It happens when a muscle is overstretched, using a dynamic movement. So it might be often when you're kicking, if you kick a ball particularly hard, or you try to kick a ball and you miss it, that puts a lot of pressure through your hamstring. It can result in a torn hamstring. Raheem Sterling's torn his hamstring a few times, often in footballers. And we get hamstring strains, not so much maybe nowadays, but certainly there were a lot of hamstring strains pre sort of more advanced training techniques in sports science. Signs include swelling and discoloration, pain when moving or stretching the muscle. This will take a few weeks, maybe a month to come back from. You can see some examples in the pictures there of slight tears within that muscle. Two more acute injuries. Abrasion. An abrasion is usually caused by a fall and scraping a body part on the surface. Open wounds need to be cleaned. You've probably done this on an AstroTurf where you've had a slide tackle, you've fallen over. You get this this abrasion. Can sting quite a bit. You often will need to treat that, and different sports or locations will, AstroTurfs for example, will have treatments that are required on those abrasions. Blisters, again, you probably will have a blister. Occurs due to friction on the skin. They can be painful, but can be prevented with the correct footwear and not overtraining. Some people use simple things like wearing 2 pairs of socks when they're performing, so the actual skin doesn't rub on the footwear or the sock itself. Seems to work quite well. This is a soft tissue injury. Concussion. This is a common injury, more common than you might think, and various sports have their own sort of a protocol for dealing with concussion. Rugby's RFU really good on this, on treating concussion. It occurs after a trauma or an impact to the head. It can cause headaches, dizziness, nausea, sometimes loss of consciousness. Signs include balance problems, loss of consciousness on occasions. The symptoms include nausea, so feeling sick, vomiting, issues with eyesight, headaches and dizziness. More prominent in some more sports than others. In America, wrestling comes out as one of the high ones. Obviously, American football has its issues with concussion, and boxing, of course, has issues with concussion. Again, more over time maybe than than sort of acute concussion. But yeah, footballers, you get concussion in football. That can be from collisions with players. It can be collision with a ball, with a post, for example. Yeah, concussion needs to be dealt with properly because it can be very dangerous. Chronic injuries, so these are injuries that occur over time. Stress fractures. Stress fractures are caused by repetitive force or impact. They're common in distance running and often result from overtraining. You can see in this x-ray, just in that second metatarsal there's a little crack in that bone. That's a stress fracture, and it just happens over time, putting pressure through that area on the ground, for example, when you're running. That results in that stress fracture. This is a hard tissue injury because it's to the bone. Shin splints. Shin splints is a type of shin pain usually caused by exercise. Tendons connecting muscles to the tibia become inflamed, leading to pain. Usually caused by high impact, again, repetitive movements. It's a soft tissue injury because it's towards that tendon, but it's a chronic injury because it happens over time. It's common in distance runners, dancers, footballers, sometimes known as medial tibial stress syndrome. It includes tenderness, soreness, just below that knee joint. Tendinosis, repetitive strain on tendons can cause injury if they're not given time to heal. So this is damage to tendons in areas that move a lot. So common injuries are known as tennis elbow, where you're repetitively putting strain through that those tendons in the elbow joint, and golf as well, golfer's elbow, types of tendinosis that you can, with the correct exercise and rehabilitation and rest to a degree, get rid of. But yeah, there are damage to those tendons. Symptoms include stinging or burning pain when moving that joint. I've had it in my elbow myself, and yeah, it's quite extreme and quite restricting, particularly if you're trying to do certain movements within a gym or play tennis, for example, like that. Okay, here's some questions you can have a go at. Explain the difference between an acute and chronic injury. Hopefully you've got some idea about what that is now. Describe two acute soft tissue injuries. Describe two acute hard tissue injuries, so they'll need to involve bone. What are signs and symptoms of concussion? What sports are concussion most common in? Gave you a little insight to that, but you might want to do some more research, maybe Google that and see what sports come out on top for the UK, maybe, or whatever country you're in. Symptoms, signs and symptoms of concussion, there was some stuff on there, but you might again want to go away and have a look at that. And what's the difference between a sprain and a strain? See if you can have a go at that one. Good luck.